as an older adult, and I'm an older adult, should it not be up to me to decide if and when to report any of my so-called elder abuse situations, and not some mandatory reporter who really doesn't even know me very well or understand me and my background?
Welcome to Conversations on Aging and Justice. We're excited to introduce our new podcast series, Ethics in Elder Mistreatment. Join us in examining ethical dilemmas in elder abuse prevention and intervention while considering principles of autonomy, consent, and justice for older adults. Today, we're kicking off the series with mandated reporting. In nearly every state, there are certain professionals who are legally required to report known or suspected elder and vulnerable adult abuse, neglect, and exploitation to authorities. These individuals are called mandated reporters. Mandated reporting laws vary widely by state and govern the types of abuse that must be reported, by whom, and when. Mandated reporting of elder abuse raises ethical considerations, including balancing an older person's autonomy and self-determination while promoting their safety and security. Also considering potential unintended consequences of reporting, such as increased harm or distress. To help us navigate this ethical terrain, we invited Dr. Georgia Anetzberger and Dr. Gassoumis to weigh in. Dr. Anetzberger, widely regarded as the OG of elder justice, has spent over 40 years as a practitioner, an adult protective services worker, administrator, educator, researcher, and community advocate. She's authored over 100 scholarly publications on aging and elder abuse and serves on the advisory board for the National Center on Elder Abuse. Dr. Gassoumis is an assistant professor of research in family medicine and gerontology at the University of Southern California. He conducts research on various aspects of quality of life for older adults, with a primary focus on elder abuse, caregiving, and health, social, and protective services. Dr. Gassoumis' most recent research projects investigate service provision by adult protective services, mandated reporting of elder abuse to APS, elder abuse in people with dementia, elder abuse multidisciplinary team models, and caregiver support interventions.
I'm curious if you can tell us a bit about what the ethical principles are related to mandated reporting.
There's about a half dozen that come to my mind, at least. Maybe there's some additional ones that come to your mind, but the first one is obviously beneficence. And when I think of beneficence, I think of the definition that usually goes with it, which is doing good and providing benefit to others. But I think mandatory reporting has its own ethical challenges related to each one of these ethical principles. So for this one, the one that comes to mind is, am I really helping older adults by reporting their elder abuse when there's not necessarily enough in the way of available services to treat their situations or prevent its reoccurrence? And the second ethical principle is non-malfeasance, which as a definition connected to it means causing neither harm nor unnecessary suffering. And again, when I think of a question related to mandatory reporting, the question that comes to my mind in terms of challenging is, will my reporting of an elder abuse situation place that older adult victim in a position where she considers worse, such as being alienated from family members who might be the abusers, but she wants to stay connected with them? Autonomy is another ethical principle that's important here. And autonomy means personal liberty or the right to control one's own situation. And the ethical question that sort of comes to my mind, which makes mandatory reporting so challenging here, is, could my mandatory reporting have the effect of taking away the older adult's right to live the life he chooses, even if doing so proves to be very risky at times? Confidentiality, obviously, is an ethical principle with regard to mandatory reporting. And confidentiality means protecting information given to you by preventing its unauthorized disclosure. I'm a social worker by background, not so much a clinical social worker, but I have done that kind of work. And so my question related to how mandatory reporting might be ethically challenging in that regard is, will my clients view me as untrustworthy if I divulge what they might regard as private information about the riskiness of their present situations? Privacy, of course, is an important ethical principle related to mandatory reporting. And the meaning of privacy relates to the right to restrict information about oneself. And the question that comes to mind as a challenge here is, as an older adult, and I'm an older adult, should it not be up to me to decide if and when to report any of my so-called elder abuse situations, and not some mandatory reporter who really doesn't even know me very well or understand me and my background? And finally, the last of the half dozen ethical principles that seem to relate to mandatory reporting, of course, is justice, which means treating everyone fairly. And the ethical question that relates at this point seems to be, why should I be mandated to report situations of elder abuse that I come across when, at least in my state, I'm also not required to report disabled younger adults subjected to maltreatment? There seems to be an inequity, an injustice in doing so.
Some of the challenges that are inherent in all of this really come down for me to the purpose of mandated reporting. Within our field, the reporting of people into the governmental systems serves two purposes, essentially. One is to link them to social services, social supports, public resources that can help support them, make them whole, following an abusive incident, following neglect, etc. And then the flip side is linkage to justice systems that pursue sometimes punitive actions to punish the offender, all with assumably the intent of benefiting either the victim or society in general. Now, I think as we think through mandated reporting, if mandated reporting were just to the social service system, the ethical principles and the ethical challenges related to mandated reporting would be much more clear in my mind. There would be a direct linkage to the social service systems, to people who could support older adults, assuming that they were willing to engage in those social supports and social services. However, the fact that our field is inherently linked to the justice system as well, and necessarily so, adds in a whole range of additional challenges. It brings to more prominence for me the principle of non-maleficence, most importantly, for the reasons that you laid out, including unintended removal of the caregiver, potentially unintended institutionalization of an older adult who was otherwise living in a situation that was desirable for them, in which they were pursuing their autonomy and putting up with some things that perhaps weren't ideal, that were the only path in their mind of keeping them living in the community, which might be their top priority. In an ideal world, we would be able to resolve all of the issues and keep people in the community. But the reality of what it is, we need to weigh and juggle thinking about how to properly address mistreatment when it does occur. Another of the things that you mentioned really is prominent in my mind in thinking about mandated reporting, and that is the lack of a mandate to report younger adults with disability. And that ties in really also to just the policies surrounding mandated reporting in general. For some states, mandated reporting refers to reporting abuse that's occurred for all older adults above a certain categorical age threshold, whereas for other states, it is more about the older adult's dependence, disability, vulnerability, or incapacity. So are we thinking about equitable treatment, just treatment across populations? Are we thinking about taking into account individuals' capacity for pursuing their own autonomy when thinking about these mandated reporting challenges? All of these are real difficult issues. And I think the reason why having a podcast and a focus on this topic, as we're doing today, is so crucial.
I agree. Let me ask you a question.
Please.
So, what do you think are the unintended consequences of mandatory reporting?
Yeah, they can be vast. They really can be vast. Well, let me first say before addressing that I think the purpose and intent of mandated reporting, as I alluded to before, is really to remove the risk, to restore the individual, and to allow people to pursue lives free of mistreatment when otherwise they would not have a direct vehicle to reporting themselves, reporting the situation they're going through directly to the authorities, to governmental entities that can step in. So mandated reporting really exists as a way to bring out of the shadows mistreatments that otherwise would not rise to the awareness of the systems that are in place to address it. However, that, of course, linking back to the ethical principles we discussed, could result in people being foisted into these systems when otherwise their preference would have been to avoid them. So circling back to some of the issues and topics that we raised initially, I think having individuals who are subject to an investigation, having adult protective services or other justice systems step in and take action, perhaps because the individual displays a lack of cognitive abilities that make people question their ability to make choices about their own circumstances and situation. And by virtue of that investigation, the system results in the caregiver of a fact being taken away. That could be just a child of the older adult who is living with them and providing some degree of care, even if it's not what we would tend to think of as an ideal caregiver in our minds. But really providing support that's allowing that older adult to remain in the community. Having that person removed through a restraining order, through prosecution, or other means really can result in the inability of that older adult to live in the community. It can result in a need for a transition to an institutional setting. And we know that transitions of care like that can themselves result in poor consequences and poor outcomes. I think we all who work in the field have heard stories of people who were doing reasonably well in the community, and then for one reason or other, they had to transition into a facility. And shortly after moving to the facility, they just diminish quickly and sometimes end up dying shortly after moving. That's a bit at the extreme end, but that is one of the more prominent ones that comes to mind for me. How about you? What comes to your mind when you think about it?
Yeah. So I agree with what you've said. I came up with my mind with a couple different twists to it. And one is that older adults can become more secretive about themselves and their circumstances, not wanting to be labeled or treated like an elder abuse victim. And I have a personal example of that. I grew up in a small city in north central Ohio. And I can remember these three brothers that one was quite a bit older than the other two. These three brothers were orphaned, lost their parents. And so they had to kind of raise themselves. And of course, the oldest brother took charge and responsibility, but he lived a very unusual life. He described himself as liking to live on the land. And what that basically meant is no home, no house structure or even trailer or anything like that, but wandering around and working as needed, kind of an itinerant worker type thing. But he raised those two boys, and when they all were adults, continued his lifestyle as he preferred it. The other two boys lived a more traditional lifestyle. They got married, they had children, they had steady jobs, that sort of thing. And everything seemed to work out fine until the older brother got old. Once he entered his 60s and 70s, reports of mistreatment or self-neglect started pouring into adult protective services. And he was just so taken back by it. And his brothers were taken back with it. And they were just really felt they had to do something. The two younger brothers bought the older brother 10 acres of land. And rather than wandering all over the county as he historically had done, he confined himself to this, in a sense, a gift of 10 acres of land, and was able to live the lifestyle he wanted, but without a lot of people recognizing he was even there. But that kind of a secretiveness came from a report. And the second one that comes to mind is that mandatory reporters can develop unrealistic expectations that reported elder abuse situations are somehow going to be resolved, not fully recognizing the limits of adult protective services under both state law as well as the typical reliance they have, funding being the reason, the typical reliance they have on sources for services and support outside of themselves. So those are two unintended consequences that come to my mind.
And speaking of the mandated reporter's expectations and the frame of mind entering into the action of mandated reporting, one concern that we hear a lot from the field is mandated reporters who are clinicians themselves being concerned that making a report about information that came up during a clinical interaction could be perceived by the patient, by their client, as a breach of their privacy confidentiality, as you laid it out, and could importantly compromise the clinical relationship that that clinician had worked so hard to build with the older adult. I don't know if we necessarily have data that back that up robustly. I've heard anecdotes from the field on both sides of this argument. On one side, clinical perspective that patients coming into you are sharing things with you because they do want help, and you as the professional really know what could be the avenues to get them some help. And so making that report is really doing honor to that clinical relationship. And then on the flip side, people who are really more concerned about older adults, the patients, the clinic, the clients, feeling like they just cannot trust their provider anymore. On the first side of it, the linkage to service and supports that the clinician really knows due to their specialization are the way for the older adult to receive help. I think it does come back centrally to the point that you raised of not really knowing fully APS's limitations. We've heard many examples where a clinician will make a report to APS by virtue of being a mandated reporter, and then wash their hands of the situation because they think that it's been turned over to the people who are going to resolve this, and there's nothing more I can do. When, in my perspective, much of the most important work that could happen to improve the lives, improve the well-being, and reduce the risk for victims of abuse exists from the combination of services and supports from a range of areas, including clinicians keeping on the radar the fact that this individual has experienced some mistreatment. Certainly not feeling like they need to investigate it. That would be APS's job. But pursuing perhaps other avenues to reducing risk, to addressing the harms and sequelae of the abuse, and really working to restore the individual from their clinical perspective, as opposed to making that report and then dealing with all the other medical or psychosocial issues that they otherwise would be dealing with.
But just as one reflection from what you're saying, I think all of us that have been in the field of elder abuse recognize that we cannot solve any of the individuals or collective problems around elder abuse if we, as an organization, as a discipline or whatever, do it alone. This is a field that has to be a collaborative one and growing across all kinds of systems and disciplines, etc. So APS alone could never do it on its entirety alone. But unfortunately, as you mentioned, not everybody recognizes that. I've got a second question for you. Should everybody be required to report, or only select professionals? Some states require everybody to do it, and some states are quite selective, quite limiting in who has to report.
people within our field tend to think of New York as being the state that has no mandated reporting. Just to set the record straight, they do have some mandated reporting in long-term care facilities and are thinking, in fact, about expanding that. But they're not the only ones who have limited mandated reporting of that nature. Pennsylvania, last I checked at least, had the exact same, more or less, approach to mandated reporting, where it's mandated for clinicians in long-term care settings, but no one beyond that. On the other end of the spectrum, as you said, we have states that require everyone to report suspected abuse, neglect, exploitation to the authorities. And then in the middle, we have states where, say, all healthcare professionals, all social service professionals, even depending on the state, some say all financial professionals. I've seen up in Maine, at least, forestry department professionals being on the list of professional groups that are mandated to report. In my mind, there's a lot of value in laying out the specific fields, the specific types of personnel who do have that mandated reporting requirement, where the mandated report would be directly aligned with their clinical relationship to the patient, to the older adult. When we're talking about others in tangential roles, tangential positions, or just members of the public having that mandated report, I think we more and more would run the risk of causing older adults who are experiencing some victimization, or even afraid of being perceived as experiencing victimization, to retreat, as you were saying before in your beautiful examples, to really put up the veil of secrecy that kept them off from communication with others in society, that really results in them being more isolated, more socially cut off from the world, which we know is a risk factor for a whole range of negative outcomes. So if an older adult who is experiencing victimization sees everyone out there as a mandated reporter, then it could impact how they experience and how they relate to the world. Also, the more ubiquitous the mandated reporting requirements are, I've heard some colleagues say the less impactful that mandate is when that mandate really does apply to just you and your specific group, and it's made known that this is a mandate for you as a clinician. There can be more emphasis on training, education, and the reporting infrastructure, versus if it's a universal mandate, it to some degree dilutes that mandate. It would be really interesting to see also how aligned the different types of mandates are with actual pursuit of prosecutory actions or other ways of pursuing legal responses in response to people violating their mandated reporting obligations. I'm very curious how those might align, and I don't think we as a field do know. I'm curious what your perspective would be on all of this.
There could even be an argument against mandatory reporting overall. And the only reason I bring that option up, although I believe in it, by the way, but I'll bring up an alternative way of looking at it, is the limited amount of research that has been done in this arena, which suggests more important than having mandatory reporting is having better public awareness, as well as having confidence in the agency or the persons that are going to handle that report. So you're going to end up with more reporting with those two things in mind than the mandated reporting itself. And I'll give you another personal example. County I was born and raised in is Richland County in the middle part of Ohio. County right next to it ended up having about double or triple the number of reports given its population than Richland County did. And so I decided to find out once upon a time why that was the case. The case was all about having confidence in the individuals that were doing the investigation, that were following up with services, absolutely believing that they were so good at what they did that, of course, people were going to make the report. So that kind of thing that comes out of research, that was just a personal example of what I've seen as well.
And that we haven't really opened the door as to whether mandated reporting should exist at all. And there are people with parallels in certainly the disability community who are in ardent opposition to the idea of mandated reporting in general. I think for a lot of the ethical reasons that we've brought up in this conversation.
One other thing to add is, if you look historically on where we got mandated reporting, it's probably because Adult Protective Services, once it began as a program going back to the 50s and 60s and early 70s, was developed more in the style of Child Protective Services, which had mandatory reporting, which also, of course, children have not quite the rights and responsibilities that adults have. And so it was appropriate to have mandatory reporting. It was felt at that point in time. But that's contrary to what you see with Adult Protective Services, because you're dealing with adults, whether they're older or younger adults, but you're dealing with adults who have all kinds of rights and responsibilities. And so probably could have been, maybe even should have been viewed differently than it was, maybe somewhat more like domestic violence is dealt with, where the individual victim, it's at their own decision whether or not they pursue assistance or whatever. Just a thought.
Absolutely. And I think with APS being a voluntary system, by contrast to CPS, it really raises a whole slew of challenges. With CPS, reporters know that when they make that mandate, CPS will be intervening, will be taking some action, will have engagement with the situation, setting aside all the debates about CPS's responses and their appropriateness. But within APS, because people can't say no to APS services by and large, the question comes up when APS is turned away, is that going to be the cessation of a linkage to services? Whereas if the clinician, let's say it was a clinician who reported an individual to APS, were pursuing remediation themselves in their clinical relationship, perhaps that existing clinical relationship would have been a better context within which to provide services, to provide supports, and to work to resolve the mistreatment in general. So along those lines, I have a question for you now.
Okay.
If an older adult is explicitly requesting that no action be taken when interacting with someone who would be a mandated reporter, what would be the ethical path forward?
So I'm assuming that the older adult in question is asking me not to make the report of elder abuse. So, well, I'm a social worker, and I've also been in Adult Protective Services, both as a practitioner, but more time as an administrator. So I put that as my background, and so I have to answer in that kind of a context. And I think I'd first indicate to that individual that I am mandated by state law to report Adult Protective Services all known or suspected cases of elder abuse in the state of Ohio. And there's a penalty for not reporting. But as a social worker, I also have a code of ethics that I have to follow, coming out of the National Association of Social Workers, which says that my primary goal is to help people in need and to address social problems. And in this particular context, I would believe that it's best accomplished by reporting the situation to Adult Protective Services. But I would also then talk about Adult Protective Services and what they can expect, because I don't think people realize or understand their limitations as well. And so I would talk about it being a very capable and competent program, but one that also respects in each individual's civil and constitutional rights, and that they function around a whole set of principles that really do have the best interest of the older adult in mind, that they believe and they follow that adults have the right to make their own decisions, even if they don't conform to societal norms, as long as those decisions don't harm others, that adults have the right to accept and refuse services, and that is to be respected. And then there's a whole set of practice guidelines that come through the National Adult Protective Services Association that fall down to each one of the programs across the country. And they include all kinds of things like the adult has the right to keep personal information confidential. They involve the adult as much as possible in developing any service plan. And focusing on case planning, they ensure that it maximizes the adult's independence in their choice to the extent that's possible, given the adult's capacity, so that it isn't that adult protective services is acting in a vacuum that doesn't, no one understands the rights and responsibilities of adulthood, because it does. And it uses all of that in the interaction.
I love how you laid that out, because I think that gets at really the heart of one of the things that is so crucial in mandated reporting. Going back to and extending the analogy between CPS and APS, I think when people in the public think about APS or hear the term APS, they think immediately to CPS, their knowledge of that system, their expectations of that system, and assume that APS operates in the same way. So commonly you'll hear people saying, well, if I'm reported to APS, they're just going to come and take me out of my home and send me to a nursing home. So having that initial education as part of conveying to someone that you are making a report as part of a legal mandate, I think really does set the stage for improving the perception of the individual who's the subject of the report about you making that mandated report to APS, that you really are doing it with an intention of reducing the risk, of improving their circumstances, etc. But also lays the foundation for when APS reaches out to them, that they may be more willing to engage with APS, knowing that knowing the norms under which their APS worker would be operating, and that they wouldn't be coming in with the same authority as CPS would in a child maltreatment case, with the ability to remove someone from their home outside of extreme circumstances where there's a lack of capacity and all sorts of other risks present. I will say one of the things that I hear from the field is that, tying back into many of the themes that we've talked about in this conversation, if there is an instance of suspected abuse that they encounter in their clinical interaction, that they will choose to address that situation through their clinical obligations, through their clinical relationship with the individual, perhaps in the presence of someone saying, I don't want to be referred to the authorities. And because they know that they are addressing the risk and the harm that's present, that they will view that their ethical responsibility to report to APS, report to the authorities more generally, is not present. Of course, legally, that doesn't fly. The question is ethically, if they know that they are providing the highest standard of the care that they can with an aim of remediating the situation that's present, perhaps that meets the ethical obligations, even if it doesn't meet the legal obligations.
So I guess I have the final question to ask you. Okay. What ethical questions about elder mistreatment are we overlooking as a field?
Yeah. So in thinking about that, I'll think a bit more broadly to Adult Protective Services as the key response agency for much of elder mistreatment, much of elder abuse. And as we've discussed, as has come up during this conversation, it's not really just elder mistreatment and elder abuse that is addressed by APS. One of the key things that they do respond to is self-neglect, alleged self-neglect. We as a field in elder mistreatment don't tend to, from an academic perspective at least, don't tend to incorporate self-neglect when we are conducting elder mistreatment studies. We think of it as something very different, something very separate, because there's not a perpetrator. But from a practice perspective, I think a lot of those lines are blurred within the APS context, because so often self-neglect will be present at the same time as abuse by alleged perpetrator. And really, the mission of reducing the risk of resolving the situation from a practice perspective might be less divergent when you think about or ask whether there is someone present or not who would be termed as the neglector in an elder mistreatment situation, or if there's no such person, and the older adult is just a self-neglector. So I think really crossing those boundaries a bit more from an academic and practice perspective would be essential and would be very beneficial. And as we're thinking about mandated reporting as in terms of the ethical obligations there, really teasing out and parsing out the mandated reporting of self-neglect versus maltreatment by a perpetrator, and being very cognizant about those two different paths of reporting. Certainly those are considered during lawmaking and policymaking, but I think that there are such central issues and questions that they require more attention by us as a field. So now I'd like to turn that question back to you and ask you, what ethical questions do you think there are about elder mistreatment that we are overlooking as a field?
So I really like the one you gave and agree with you entirely. So the one I would offer is that as a question, if we really want to address elder abuse and prevent its reoccurrence, what is our responsibility to the perpetrator, especially those that don't intend to harm, but lack the knowledge, capacity, or resources to do otherwise? And I think even what research has suggested, that in terms of stopping elder abuse, it's probably better to work primarily, around the issues, risk factors, etc., with the perpetrator than the victim. And I can think of examples of that being the case. I'll give you one such example. This was a situation I came across as a researcher in interviewing perpetrators, and this one situation left me feeling so differently than all the other situations in talking to perpetrators left me. And this was an individual who was one of 6 children, and he had been reported to Adult Protective Services for physically abusing his mother, who had Alzheimer's disease, very severe Alzheimer's disease. And he was living with her at the time, taking care of her. The abuse in question was he had slapped her twice because she refused to eat. And he was the only one living at home and the only one providing care, even though the other 5 children lived in the area and were all adults and all could be helpful to care. But he was the only one left with that responsibility, and I think it was largely because he was at home. But he was at home because he was developmentally disabled. And so he was really trying the best he could possibly do to be a caregiver to this mother that he loved dearly, but that was, at this point in time, difficult to provide care for. I think that would be a situation that one could deal with best by dealing with the perpetrator and helping him to be the caregiver he wanted to be.
It's a beautiful example, one that I think exemplifies in a particularly extreme case the challenges that caregivers do face when providing care, even those who are the best intentioned. Perhaps they just aren't as knowledgeable about the norms of care, the standards of care that they should be pursuing, and therefore are not meeting their obligations as a caregiver, are leaving things undone that could result in pressure ulcers, all sorts of other consequences, or those who just are so overwhelmed by some of the tasks, especially in the face of resistive behavior, when there's dementia or other things present, and who might in a moment lose their temper and do something that is out of character or that they hate themselves for after the fact and want to resolve to do better. And I agree with you completely. Supporting those individuals would be a wonderful way to ameliorating the abuse present and helping to restore not just the victim, but the family unit.
Thank you for tuning in to this episode of Ethics in Elder Mistreatment. Subscribe to our channel on YouTube or Spotify so you don't miss future conversations exploring ethical dilemmas in elder abuse prevention and intervention.